need my cheat. Okay. So Dr. Samuel Brown is the medical director of Brown Fertility. He completed his reproductive endocrinology and infertility fellowship at the renowned Jones Institute for Reproductive Medicine under IVF pioneer doctors.
It's got a long one.
Georgeanna and Howard Jones Jr. He is dually board certified in
Obstetrics and Gynecology.
obstetrics. Yep, I'm not going to get that one, guys. In gynecology as well as reproductive endocrinology and infertility, providing patients more than 20 years of training and expertise. Awesome, right? Yes, they're like, yes, it's so cool. Dr. Samuel Brown is an acknowledged leader within his field and has been directly involved in the management of more than 10,000 in vitro fertilization cycles.
Wow.
He was also the first surgeon in the state of Florida to pioneer minimally invasive robotic gynecological surgery for treatment of infertility. He has successfully completed over 2,000 hospital-based surgical procedures, including extensive experience performing tubal reversals. Dr. Brown is a recipient of the Florida Medical Association's Distinguished Physician Award. He has also been named one of America's top obstetrician gynecologists.
Got it.
3 years in a row by the Consumers Research Council of America and has been inducted into Strathmore's Who's Who for reproductive endocrinology and infertility physicians. Dr. Brown was selected by his peers for the award Best Doctors in America in 2009-2010 and again in 2011-2012. Dr. Brown's major interests include the practice of egg donation and high-quality in vitro fertilization, with special emphasis on cost-effective approaches to help couples have access to treatment, as well as pioneering minimally invasive reproductive surgical techniques. Dr. Brown's commitment to excellent results and personalized patient care are central to his practice philosophy. So without further ado, Dr. Samuel Brown.
Very welcome, everyone. The goal is to spread the science. And you guys are here to learn about science and things in our world that are scientific. So tonight we're going to talk about something in medicine. You've had some wonderful lectures this week. I applaud you for pushing science and encouraging the excitement of science. And tonight's a little different. I love that what your speakers have different titles throughout the week. I think it's great. You had a great agenda. It's a very, very nice job. And so we're here to help you get excited about another type of science. Science that's involved in medicine, a medical type of science. We have a scientist in the back, Josephine. She's an andrologist in the back. She's also a scientist that I work with. I'm very proud to work with her. And her husband, who's awesome. Now, tonight, I have to keep, it's a scientific medical talk, and we're going to talk a bit about what is IVF, what is this weird thing called IVF, what is infertility, and I'm going to keep it G-rated or PG-rated the best I can. And let's go. Let's see what we got. So, as an infertility doctor, this is the way we're brainwashed, is we have patients that come in that are suffering and they want to have a baby so bad and they can't have a baby. So the way we look at that couple when they come in is, wow, this woman is born with millions of eggs. How can we help them have a healthy baby? And so they can have a family and have the wonderment of family. So that's kind of how I'm brainwashed. I'm thinking this woman's born in her ovary. A woman is born with over 2 million eggs. A human female is born with over 2 million eggs. And it's amazing how the process goes through where one egg will pop out a month, and how can we work with that system to help them have a baby without causing harm. Okay? So we have a fancy office downtown Jacksonville. We're actually all over Florida. We have offices in Melbourne, Tampa, Orlando, Tallahassee, Gainesville, Ocala. We're kind of all over Central and North Florida, and that's kind of what we look like. But my specific title, I'm a reproductive endocrinology and infertility subspecialist. Well, what the heck is that? That's kind of a lot of words. in general, they'll say infertility specialist. And the OBGYN doctors refer patients to us typically, so if couples are having trouble having a baby. And in short, they'll call us an REI. And in medicine, it's tough. I feel bad for consumers. I feel bad for patients who, they're, what the heck is an REI? Everything's an acronym. Everything's an abbreviation. It's bewildering. I can remember, when I was learning these things, I'm like, oh my God, what the heck is REI? What is ACOG? What is an OBGYN? All these acronyms, it's confusing. But this is what I am. I'm a reproductive endocrinologist, not a medical endocrinologist. I don't take care of people with thyroid problems or diabetes. I'm a reproductive hormone expert for men and women. A reproductive hormone expert. And in general, again, they'll call us an infertility specialist. So what's it take to do what I do? What kind of school do I have to go through? It's a lot. It's 4 years of college, and usually in a science. It's a Bachelor of Science degree in biology. I was a microbiologist and had 4 years of college in microbiology. And then it's 4 years of medical school. And then it was a 3-year fellowship in reproductive endocrinology and infertility. So after high school, that's what, 11 years? Where do we dropped some years there. Let's see, college, med school. Oh, we dropped one. There's 4 years of OBGYN residency. So after medical school, I had 4 more years to become an OBGYN doctor, and then it's 3 more years to become an infertility specialist. So I just have to fix that slide. I shorted myself 4 years. So it's 15 years of after high school education to do what we do. I lost a lot of hair in those years, but it's all been good. And I joke with patients, not sort of. We say, Google for 10 hours, it's a good start for discussion. And I'm a doctor that I believe in the internet. I think you can educate yourself pretty well with the internet. You can find a lot of great information on the internet. And I'm one of a lot of doctors don't like you going to the internet before you come to talk to them, because some doctors just don't have the time or the energy to discuss what your findings were with the internet, and they just kind of want to tell you what to do. No, our patients are very smart and articulate, and I'm glad that they go to the internet, they learn it's kind of like a foreign language, like when we're talking about andrology and endocrinology, it's almost like a different language. So I'm glad when patients go to the internet to learn the words that we speak, okay? So tonight I'm going to try to show some of the basics on what is fertility treatment, and specifically this fancy thing called IVF. We'll go from there. So again, one of those scary acronyms, IVF. Oh my gosh, what the heck is IVF? Well, it's called in vitro fertilization. But what the heck is in vitro fertilization? That's Latin. So it's helping people have children outside, using their body and outside of their body. Okay, and we're going to get into detail on what that is. And we also throw around terms like egg. A human egg is also called an oocyte. And an egg and a sperm, when an egg fertilizes with a sperm, it's called an embryo. Okay, it's called an embryo, a fertilized egg. Well, it all started back in 1978. And was it 42 years ago, 43 years ago? In the timeline of things, that wasn't very long ago. But, and here in the United States, it started in Norfolk, Virginia. There's a famous place there. It's kind of like the Harvard for fertility, where they had the first IVF baby in the United States was in Norfolk, Virginia. And these are some of our heroes. There's Dr. Mason Andrews, the older gentleman in the middle, and the woman on the right, Louise Brown. She was the first IVF baby in the world. She lives in England. She was the very first baby in England, and the first baby in the United States was this woman on the bottom right. Her name's Elizabeth Carr. She's a news reporter up in Boston. So the first IVF baby in the United States is a fairly young woman, from my perspective, in Boston. And when this first came about, it was a big deal. And people were afraid. They said, well, man, with this science, are we going to make a Frankenstein baby? It's kind of scary. They've never heard of this stuff before. How can you make a baby outside of the body and put it back in the body and it not be weird or Frankenstein or something? Okay? These are pictures of the mass demonstrations in the streets. People were afraid. They said, "Oh my God, this doesn't seem natural. This is bad. We're going to make monsters." So everyone was afraid. There's demonstrations in the streets. They were threatening all these doctors. They were going to kill them. They had to board up their laboratories. And it was huge news back in the early 1980s. And nobody in here is really old enough to remember that. But it was big time news up in Norfolk, Virginia. Everyone was afraid. And I think it is a bit of a natural human reaction to be afraid of something new until you see evidence or science that proves that if you have enough evidence in science and objective data to show it's not bad. So initially things are scary. They are. So the test tube baby began. So there's your test tube babies. This was the very first patient in England. Her tubes were bad. In her body, her fallopian tubes were bad. And I'm going to show you more pictures in a minute. In England, they did a natural cycle extraction from a natural ovulation. They got one egg from a woman, fertilized it, put it back in her body, and she had a baby. And that was the first baby in the world in England. That's her, Louise Brown, that older woman over there on the far right. That's her as a baby right there. That was 1978. And then in the United States, the very first one was in 1981. But by today's standards, the first modern world IVF, the way we do it now, the first one in the world was in Norfolk, Virginia. Okay? It's a big deal. Test tube babies. It's all kind of scary. I actually named my son after this gentleman. He's the unsung hero in all this. He's the one his name was Mason Andrews. I never met a more effective individual to bring scientists together to make things happen, which is incredible. Okay, so the birth of IVF, 1978. It was this Austin Powers looking individual and this other gentleman. They get credit for the first natural cycle IVF baby in the world. They won a Nobel Prize for this. And there are heroes. They were attacked over this. People were afraid. They thought they were going to have a Frankenstein baby. And then in the United States, these two characters, Dr. Howard Jones and his wife, Dr. Georgeanna Jones, out of Johns Hopkins, came down to Norfolk and had the first, by modern standards, IVF baby. And because of these heroes, these are our heroes, they use science. This is one of the areas of science, or in medicine, that science is really applied. There's a lot of medicine where they kind of give you pills and it might kill an infection in your throat. But this area of medicine, they really use science. They would compare 100 patients with one treatment to 100 patients with a different treatment. And it was pretty easy. Like the end point was who gets pregnant or not. And then they figured out what works from that. So they really applied science to medicine to make these miracles happen. It's amazing. So these are our heroes. These people were all threatened. All their lives were threatened. They threatened to burn down their buildings, kill their families. And all they were doing is trying to help suffering couples with infertility have a baby. And they stuck with it. They were tough. They didn't give in to the pressures. They didn't give in to the media attacking them. They stood their ground. And now there's 15 million babies born from IVF. That's enough to populate a few islands or continents, possibly. It's science in action. It's 15 million babies have been born from IVF. That's huge in just 40 years. Just 40 years. Now in the United States, I think 5% of babies are from IVF. And in countries like Israel, almost 20% of babies are from IVF. So this is pretty awesome. These are couples that are suffering. They couldn't have a baby, and we help them have a baby, have a family. Okay. I won't go into detail, but there's a lot of reasons we do this thing called IVF, which we're going to go into detail on. What is IVF? People that have sperm problems or egg problems or endometriosis problems or hormone problems. There's all these problems that we have to deal with, and that leads to IVF. And some basic anatomy, there's a uterus, that's a womb. What we see, a womb in the room, but that's a womb in the center there. That's called the uterus. The scientific word for that is a uterus. And there's ovaries. So this is for a woman. This is her reproductive structures. There's an ovary and a fallopian tube. So an egg that comes out of the ovary, it gets in the tube. A sperm meets an egg in the tube, and then it becomes an embryo, and it comes down to the uterus, and that's where a baby is developed, is in the womb, or the uterus, okay? It's pretty complicated. It's pretty awesome how the brain can signal your body to do all this. And it all starts in the brain. It all starts right there, right between your eyes. And there's a hormone, there's a gland there called the hypothalamus, and that's what you see here on this picture, the hypothalamus. And then there's the pituitary, we call it the master gland, the pituitary, the hypothalamus. And there's these signalings from the brain to that to send hormones throughout the body that make all this happen. And that's why we have to go through a lot of schooling, is to figure out how that works and why the body does that and how the body does that. It gets complicated how a dominant follicle develops, an egg pops out, and there's an ovulation. The lining of the uterus has to develop properly for implantation to have a baby. It's pretty amazing. Now, I'm going to show you what IVF is, or in vitro fertilization. And probably the simple way to say it is, we pull an egg outside of the body, we fertilize it, and then we put it back in the body. And it's really good for people where their tubes don't work, where they have really bad sperm or really bad eggs, or they have endometriosis or other problems. That's the only way they can have children. It's the only way they can have a family for many people. And there's always wonderful things like adoption. You know, adoption works to have a family. This is a way to use your body to have a baby if there's problems. And that's why this was really developed for